Welcome back to the Federal Drive with Terry Gerton on Federal News Network. More and more veterans who seek behavioral health care have been referred by the Department of Veterans Affairs to community providers outside the VA. A new GAO report finds that many of these providers are not meeting basic process and training requirements. Here with more on these new findings is Director for Healthcare Issues at GAO, Sharon Silas. Sharon, thanks for joining me today.
Thanks for having me here, Terry.
Well, tell me a little bit about what initiated this investigation from GAO.
Sure. So this work was part of a mandate from Congress for us to take a look at behavioral health care issues. And this is actually the second report we did in response to this mandate.
So tell us a little bit, first off, about the concept of community care for veterans. Why is that important, and why is Congress interested in it?
Sure. I could talk a little bit about that. So when the VA is having problems meeting the needs for veterans in terms of appointment scheduling for medical appointments, the VA can refer an eligible veteran to the Veterans Community Care Program. So when there's care not available at a VA medical facility, and then they will refer the veteran out to a community provider where they'll receive care from that provider. And it's usually for specialty care services, such as behavioral health care. And so VA providers then can refer a veteran to a behavioral health care provider outside of the VA for treatment such as psychotherapy or psychiatry for mental health conditions or substance use disorders.
Does a behavioral health provider in the community have to meet certain standards to be included in VA's referral network?
Well, the providers that are in the community care program are part of a network with contractors that VA works with. And VA has its own requirements for coordinating care with these community providers. So two of the issues that we looked at as part of our review was looking at the exchange of medical documentation and then also training for cultural competency to work with veterans.
So Sharon, help us understand how VA then interfaces with its contractors. Behavioral health is so important when we think about veteran care. What is the relationship between VA and its contracted providers?
So VA has a contractual relationship with their contractors that provide a network of providers in the community for veterans to receive care. And they can receive care around a variety of specialty care, healthcare services. So it could be anything from like dermatology or cardiology or behavioral healthcare services, as I'm talking about today.
All right. And so in this case, you're looking at how VA and those behavioral health subcontractors share information, right? And you didn't find that they do that very well.
That's correct. VA has a responsibility to oversee their contractors. So they have a number of requirements that they have for their own VA facilities and the staff that work in those facilities to help ensure that veterans are receiving quality care out through the community care program. So there is a relationship between the VA and the community providers. So for this review, we were looking at behavioral health care issues. We identified 225,000 veterans that were receiving behavioral health care services through the community care program. But 90% of those veterans had a VA primary care provider. So that means there needs to be coordination of care between the behavioral health care provider and the primary care provider that's at the VA facility. We also learned that 71% of those veterans were later going to be returning to the medical facility to receive subsequent behavioral health care. But continuity of care is extremely important. And one of the ways that they do that is through the medical document exchange between the VA community provider and the VA medical provider. And so the medical documentation would include information from the behavioral community provider, such as evaluations, diagnoses, and progress notes, for example, on therapy sessions.
Obviously, so much about mental health is connected to physical health, but why weren't they able to share the records back and forth? Was there a technical issue? Was it just they were trying to pass paper copies back and forth? Where's the breakdown in that system?
Sure. So one of the key findings in our review is that VA doesn't monitor whether medical documentation is getting back to the VA medical facilities. In fact, we found a significant portion of medical information was missing from some of the referrals that were reviewed from the VA. So when a VA provider makes a referral for a veteran to see a community provider for behavioral health care services, it usually can end up being a number of doctor visits. So we looked at over 350,000 referrals for our scope of our review for behavioral health services. And that amounted to about 4 million visits to community providers during the course of the 3 years. And there are 2 points where community providers are required to return medical documentation back to the VA facility. They're first supposed to return medical documentation after the first visit, and then they're supposed to return medical documentation after the last visit. And so, as I mentioned, a referral can have numerous visits. So they might have to submit documentation after the first visit, and then they would have to submit documentation, say, after the 6th or 7th visit. And what we found based on our data analysis that it was that 33% of the referrals were missing medical documentation after the initial visit. And then for the final visit, there was no data available from the VA on any medical document exchange because VA does not provide guidance to the facilities to obtain that medical documentation. And what VA officials told us was that it was more challenging to get that final documentation because they weren't sure when the veteran's final visits occurred. But as we note in our report, when the VA provider issues a referral, it also includes a start and end date, and then it can't exceed a 1-year period. So there are some specific time points where they could try to obtain some of that final documentation.
I'm speaking with Sharon Silas, Director for Healthcare Issues at GAO. So, Sharon, whose job is it to get that closeout record from the behavioral health provider? It doesn't seem like the primary care provider could go on and make a rational treatment plan without it. So where's that breakdown?
Sure. It's really the responsibility of the VA medical facility staff. When we talked to VA officials, they said that at least on their end, the process is very labor intensive and time consuming because it often requires multiple attempts to try to obtain documentation from these community providers. Also, the documentation has a variety of methods that can come back to the VA. The VA has an IT system called the Health Share Referral Management System that they use to manage referrals. That would also include managing the medical documentation, but very few community providers actually use that system. Most of the medical documentation might come back through fax or even by mail. And so the VA also told us that they had insufficient staffing and that they've been prioritizing scheduling appointments for the veterans with community providers over focusing on doing that medical document exchange.
I want to come back to your recommendations because I think it's so important, but I also don't want to lose track of the second big finding that you had about the training and qualification of these behavioral health providers. So tell us about that, and then we'll come back to recommendations.
Sure. So the other area we looked at was cultural competency training for community providers. So it's really important for these community providers that are providing behavioral health care services have the information and education that they need to treat some of the unique behavioral health care needs that veterans might have resulting from their military service. So this could be PTSD, traumatic brain injury, or military sexual trauma. And so VA has developed some required and recommended trainings on some veteran-centric topics that community providers should take. And what we found in our review is that VA is monitoring the extent to which these community providers are completing 8 core trainings that they've developed. One of the trainings is required, which is opioid safety, and then there's 7 recommended trainings. And one of our key findings from this review is that out of the 22,000 community providers that were providing behavioral health care services to veterans, only about 2% had completed one or more of the trainings. And that means about 98% of those providers were not taking any of the recommended trainings.
We all know that veteran mental health is such an important issue. To not be competent in veteran unique behavioral health requirement seems to me to be kind of a gross failing. How do you put these two back together so that VA is making sure veterans really get the behavioral health treatment that they need and deserve?
Sure. So in our review, we made a total of 5 recommendations to address some of the deficiencies we found in kind of this coordination and continuity of care with community providers. One of the recommendations is looking at developing guidance for obtaining that final medical documentation. because there is no guidance to do that. So that would require, or that would recommend that the VA medical facility staff would obtain that final documentation after the visits are completed. And then we also made recommendations to develop goals and related performance measures for obtaining both the initial and final documentation. And then the VA facilities and VA itself can use that to help inform any progress making towards their goals. We have a fourth recommendation to establish and monitor goals that are related to performance measures for community providers to complete those core trainings on cultural competency. And then lastly, we made a recommendation for VA and its contractors to communicate clear and accurate information on core trainings to community providers. Because what we did find was that there was information that was out there for community providers to be aware of these cultural competency trainings wasn't consistent and it wasn't clear.
So how did the VA respond as we're hearing that they want to have a major staffing reduction and a lot of this issue seems to be associated with understaffing? What was their get well plan here?
They concurred in principle with all of our recommendations and said that they were going to start taking actions to address those recommendations.
When are you scheduling a follow-up?
We have to follow up with the agencies and any actions they're taking to address their recommendations. Within 180 days, they have to send us a letter with more detail of what they're planning to do.
Well, we'll check back with you in 180 days to make sure that they're doing what they promised to do. Sharon, thank you so much for bringing this issue to our attention.
Thanks for having me, Terry.
Been speaking with Sharon Silas, Director for Healthcare Issues at the GAO. We'll post this interview along with a link to her report at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive wherever you get your podcasts.